Is in the Pledge of Allegiance. Would you please stand? Our dear Heavenly Father, we're thankful for this day. And Father, we're thankful for this community we all live in. Just continue to bless it and just help us to be good stewards of all of our customers. And just give us wisdom today, Father. Help us to understand the things that are presented to us. Help us to be understanding and wise as far as how we need to work with our employees. And Father, we thank you for each one of our employees, their families, and their children and everything. And we just thank you for the hard work they do to make sure the Joint Water and Sewer Commission provides good water and sewage to so many customers. Thank you for this day and help us to glorify you. It's in Jesus' name we pray. Amen.
Amen. Join me in the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We don't have anybody here for public comment, so we'll proceed to the committee updates. We had a Facilities Committee meeting yesterday, and we made recommendations to submit about 8 or 9 different items for approval of the full commission. It includes UV equipment purchase at Academy Creek, the Dunbar Creek rehab phase services contract, the Dunbar Creek UV and filter purchase there, pump station 2032 replacement pumps, the Academy Creek clarifier gearbox, standby generator rental agreement, pump station RTU panel purchase, and we had 1 infrastructure and easement dedications. We also had a good report from the water system and all the wells that we have operating. This is a new report that staff has started giving us at the facilities meeting. And at the water pollution control plant, those reports, all plants are well within permit, and we've had some flows that were kind of suspect, and so some of the flow meters have been recalibrated. That indicates that we might have a little bit more capacity than we thought at some of our plants. We also had a good report on the capital projects that we have ongoing. A lot of these projects are getting close to finishing up. Some of the bigger projects are, but we still have a lot more projects that we are bidding or in the process of construction. And I think that concludes my report. I would like to welcome any commissioners that ever want to come to a facilities meeting. Sometimes they're pretty interesting because we talk about a lot of things there that we don't need to talk about here because we get more into details, but we get to see all those pretty pictures of all that work going on in our county. And the staff's doing a good job on making these improvements for our customers. I'd like for Commissioner Duncan now to give the report on the Finance Committee meeting yesterday.
Thank you, Mr. Chairman. Yesterday we met and discussed a number of items, and those will appear today. And for brevity, I will not go over those. But just a couple of highlights. Our utility continues to remain in a very strong financial position. From a budget standpoint, we're executing better than the budget as approved for the fiscal year. Significantly, I will draw attention to our net operating revenue is $2.3 million above budget, which is a positive. And then on the major projects list, we are completing almost $25 million worth of capital improvement projects in the fiscal year. And another item of importance is those continue to meet the expectations on scheduled performance for large projects. Just a few years ago, we implemented here project management discipline, and that allowed us to learn more about what we're doing and how to manage those projects, not only financially but on execution of getting them done through our contractor partners. And so we continue to meet reasonable expectations on that. And that concludes my report.
Thank you, Commissioner Duncan. We'll move to the approval section of the meeting. First item is 2022-2023 employee health insurance renewals.
I'm going to ask Ms. Katina Tyndall to come up, and we're going to kind of tag team this presentation here. All right, so I'll let Ms. Katina go through what she went through yesterday first, and then we had a lot of discussion at the Finance Committee yesterday, and you asked for more options, so we brought you options to consider.
That is right. Thank you so much, and I know we have 2 new commissioners, so I'm going to give just a quick brief summary, but please do know that if you all would like to get together at another meeting and talk about this in more detail, we are happy to do so. We know that these meetings move a little quickly and fill you with a lot of information, so we're happy to expand on that. And this is only brief for your time, not ours. We'll make time for as much as you need. So just a couple years ago in 2020, we moved from a fully funded plan to a self-funded plan. And that just simply means that now Joint Water and Sewer Commission is the insurance company. So you pay the claims you owe and not paying the amount that the insurance company would like to put in their profits. So we have seen over the past 2 years, the claims have been lower than we anticipated, which is good. Part of that is due to COVID. Part of that is people not using insurance like they have in the past. But we're starting to see some return to care, and those claims are ticking up a bit. We have an individual stop loss of $50,000 when we started. We moved that to $60,000 last year. That's been good because, as you'll see in the claims on the 3rd slide when we go through it, we only had 2 people, almost 3 and 4, that got close to that $60,000. We are looking at around $400,000 or $500,000 in savings overall from the fully funded, but we have to remember that we have had a fluctuating staff. Right now, we're at 110. We have 20 open positions. I say we because where are we? And those 20 open positions could be people that all take insurance, which could cause all of these rates to go up. So as you're making decisions, keep in mind that we could be adding another 20 even potential families to that with their claims and their premiums from there. The non-medical is in a rate guarantee, so we do not have any increase or change to the dental, vision, life, short-term or long-term disability. Any questions about that? Okay. So again, the claims are running better than expected, and if you want to look at these slides, and you have them in front of you in your packet, because I realize this is hard for anyone to read. And so that first page just goes over where we were on fully funded. And then that was year 2018 and 19. We have 2019 and 2020. And then what happens at renewal, and this is a little tricky, usually at renewal you are able to look at what the claims have been for all 12 months, but when you're self-funded, they're waiting on those claims to still come in. So your renewal is August 1, and here we sit in the middle of June. So if I go to the doctor today, my bill may not show up until the middle of August. So when the insurance company is calculating what that number is, they're going all the way back to the end of April that they stop. So we're really only looking at 9 months of claims. So then they guess or project what they think those claims are going to be based on past claims, based on underwriting, and what they think they might look like. And so they give us those projected rates for the next 12 months. And we can see that in 2020, they projected it to be the 1.775 million. But we actually, when we had the full 12 months, we're at 1.8 million. So it was a little bit higher. And this year, as we look at our renewal, we can see that the claims are projected at 1.8, but we're only sitting at 1.4 currently. So we realize that those claims are probably going to come in, but the point of this slide is just to say, look where we were on the fully funded if we were letting the insurance company keep all of our money. So any questions on that at all? And one of the things that was a question yesterday, and I do want to clarify that Commissioner Stevens pointed out, when it says financials reflects employer cost only, that does not apply to all of the columns. That is just because what Joint Water and Sewer pays and what you might see in finance is what Joint Water and Sewer pays, whereas our numbers are what the employees and Joint Water pay collectively. Okay, so next page. This just breaks down the current, the renewal, and then the negotiated renewal and an alternate plan. So with the self-funded, you actually have to buy insurance. You're still buying a policy. You're buying a $60,000 individual or $1 million group policy, but there's still a cost of insurance. And those are what's considered the fixed cost. And then you have the projected claims. So we can see that our fixed costs were going to go up a little bit. The claims were good. We were having a good year. It was pretty easy to negotiate them to stay flat on those fixed costs. So we didn't see an increase there where we were slated to have a 2%. And then you can see that the claims projection is up from the 2.1 to the 2.2 based on where we are. We have seen a lot of employees use the insurance over the past year, and we think that that will probably settle off in the next year. But we can never know. The alternate is if you want to move that individual stop loss from a $60,000 to a $75,000. You can see what that difference is. The $75,705 would be the increase to the fixed cost, but your break-even point would be 5 employees. So if 5 employees met that, and I think when we talked yesterday, the biggest variable there is the 20 employees you haven't hired yet. So you have to guess as a commission whether you think those 20 employees will impact this change enough to leave it as is, or if it's worth the risk to take.
Well, we should be able to proportionalize those.
So.
Okay.
How many?
Yes, yes. So to your point, when you're looking at what those large claims look like on that last slide, we have 2 employees who met the over 60, another employee that got very close, another employee that was a little closer, and then the others are falling below 40,000. So we don't have a lot of people meeting that. So it's very possible that you could end up saving that money over time, and it certainly has worked out when we move from a 50,000 to a 60,000.
So to your proportional argument, 4 out of 110 have met the $50,000 level. So if that continues, you're looking at potentially one or 2 of the 20 others would be
And it's
added.
people who fully meet it, not just meet the threshold to get there.
Right,
That would be
that's
The
right.
break-even point is that they all cap, not that they all.
That's right.
Right,
That's right.
correct.
So any questions on that at all? Do we want to start the discussion with moving the individual stop loss?
Yes.
Okay,
I've got that.
all right, so I'll step aside and then I'll come back when you're ready.
No, you hang out.
Oh,
You are the insurance expert.
okay.
I do math. All right, so I apologize. This is not fancy, but it's got information that you requested on it, so bear with me. All right, so we went over the historical cost. This is just a reminder where we were at, 2.3, 2.2, and that's employee plus employer. Currently, our employees pay about $400,000 a year into the plan with their biweekly deductions. So our cost would be about $400,000 less than what you're seeing there from what you're seeing on the joint water and sewer financials, but that's the total cost. So stop loss, currently we're at 60,000, and if we renew at the 60,000, there's no increase to our fixed cost. Is that correct?
There's no increase to this cost. Correct.
If we move to the 75,000, you see there's a $75,000 savings on fixed cost. And we talked about that. We've got 4 claims over 50,000, 2 over 60, and 1 that would have exceeded the $75,000 mark. So, like I said, with 20 people, you're looking at 1 or 2 more. So you're looking at about potentially 6 people maybe hitting that mark, and 5 is the break even.
But we're currently at 60, not 50, so those 4 don't count, right?
Well, they're getting close to 60. We got 3 months worth of claims left. Is what I'm.
Oh, that's not annualized.
That's not annualized. That's just as of today. They've got
As of the
over
end of
50.
April, actually.
Yeah.
I thought you had annualized the data.
No, I didn't do that. So that's just what we had today. So if they have ongoing treatment, that could increase a little bit more, you know. So you could save 75,000, but if if 5 people go from the 60 to 75 mark, then you eat up your savings, but you still break even if you do that. So that may be worth considering on the stop loss, you know, based off what you're saying proportionally. It's probably a pretty good bet, but we've got other options we want to talk about, so we kind of want to talk about the whole thing holistically probably before we start making decisions. Yesterday, Commissioner Stevens brought up several points, and one of the things he talked about was the fact that he he believes, and this is probably true, that people are probably deferring health care because they don't want to have to pay the high deductibles that we offer on our plans. We offer a health reimbursement account where that if you exceed 50% of your deductible, any amount over 50% of your deductible up to the full amount of your deductible, we will reimburse you. So if you're on the $1,500 plan, once you exceed $750 of your deductible, any amount between $750 and $1,500 will be reimbursed back to you on a check once you provide the documentation. Same thing on the $3,500, so anything over $1,750 would do that. One of the options to offer what would be effectively a lower deductible without changing the plan would be to increase that from, say, 50 to 75%, and then your effective deductibles are $375 and $875. So last year, we had 39% of the people reach the $1,500, or 39% of the people requested reimbursement on the $1,500 deductible plan, and 26% reached the requested reimbursement on the $3,500 plan. But if we assume at the lower amounts that they would have to hit, 100% would request on the $1,500 because they'd only have to spend $375 of their own, and 50% would be $875. The increase in maximum HRA payments at that would be about $40,000 a year. So that'd be increase that we would be paying out if those claims actually came true. Our costs would not increase unless they actually used the health care and had to spend it against their deductible.
But this is based on the current numbers. Of
Based on the
110.
current numbers, that's
So
correct.
if we added 20 more in there, that could increase the cost.
20 more in there, you're looking at, yeah, so somewhere in that ballpark of probably another $8,000, $10,000 at that point. All right, so the other option would be to basically charge the exact same amount for the $1,500 and the $3,500 plan, which would effectively eliminate the $3,500 plan. If the deductions were the same, most people are not going to take a $3,500 deductible instead of a $1,500 deductible. But I would like Ms. Tyndall to explain the co-insurance percentage and what that means on the $1,500 versus the $3,500.
Yes.
Because that is a key piece of information about these plans.
Yeah, so the $1,500 deductible plan is an 80% plan, whereas the $3,500 deductible is actually a 100% plan, which means that most things after the deductible on the $3,500 are covered at 100%, whereas the $1,500 falls into the 80%.
So if you exceed the deductible, you'd be responsible for 20% above the deductible.
Right, right. So the total out of pocket, but the total out of pocket for the $1,500 is $4,500, whereas the total out of pocket on the $3,500 is $6,000. So all the co-pays now accumulate towards that out of pocket, but it is a lower out of pocket for the $1,500.
Okay. So to do that, because we have, I don't remember the exact numbers, like 17 people taking
17 people.
the $1,500 plan, they would see a reduction in what they're having taken out of their check. And that would be about $22,000 that they would not see coming out of their checks cumulatively for the year. So we would absorb that as joint water and sewer. The HRA would still be in play, but the reimbursement amount would be less because you're reimbursing a max of $750 instead of a max of $1,750. So we'd actually save about $10,000 on the HRA. So between premiums and HRA savings, it'd be about $12,000 increase to joint water and sewer and decrease to the employees. However, potential claims would increase by going from the 35 to the 15, because then anything over 15 would go towards claims and not towards deductibles, and you had spoke with them about what that would look like.
Yes. So, when we ran the member cost sharing report just for, because we were looking at a 12-month period, so we ran it from August of 2020 to the end of July in 2021. The people who met a $750 deductible, which essentially half of that is reimbursed, was about $140,000 in claims minimal. So we're looking at a projected amount of about $140,000 in claims by lowering it there, just based on the amount of people that met their deductible. But again, that's 2020 to 2021.
Right.
So it's all a good guess, but a guess
So you're
nonetheless.
likely looking at somewhere at least in the 150 to 160,000, and depending on claims, it could be much higher than that if we were to do that. And Plan C, which is just changes everything, would be to reduce premiums across the board by 20%. Keep the plans exactly as they are, keep the HRA exactly as they are. And so on the left, that is the biweekly deduction for what's coming out of people's paycheck for the current plan. EO is employee only, EE and SP is employee and spouse, employee and child, and then family coverage. So we offer a $1,500 plan, a $3,500 plan, and a $5,000 HSA plan. So you would see a reduction at 20%. The reason 20% was selected was because this table at the right here, that makes if we reduced it by 20%, that makes the $1,500 plan competitive with what we're currently paying for a $3,500 deduction. So essentially, if somebody wanted the lower deductible, by doing this, they would take between $11 and $20, depending on the coverage amount they're talking about, additional out of their check every 2 weeks, and then that would allow them to opt into the lower deductible for a small amount if that was something. Just take the 20% savings in their deductions, and they would just see a reduction in their deductions and more money on their take-home pay at the end of the day. So what does that look like? The problem is we don't know how many people would elect to move to plans. I don't know how many that would be. I think a lot of people would probably stay where they're at and take their 20% savings and, enjoy the $15 a paycheck that they're getting out of their, more in their check. If nobody changed their plans, you're looking at $75,000 increase of joint water and sewer, and that's $75,000 in savings all for the employees. That's the only difference. If a quarter changed from the 35 to the 1,500 with the increase in claims, you're probably looking at around 110, and if half the people did it, you're probably looking at 150, and that's combined premium savings that joint water and sewer would absorb and increase in claims. So a lot of options. We had a lot of discussion yesterday, so we can kind of lead this wherever y'all want to go, but this is kind of.
I'll say I don't like option C at all. I don't think that accomplishes what my goal was when we first brought it up, which is to give people access to health care. And I realize I work at the hospital, that's not what this is about. The reality is our team members, we got 105 people taking health care insurance and 129 taking dental. So either the people believe that our dental's so cheap, might as well take it, and that they can't afford the health insurance, or for some reason people are not taking health insurance. I mean, how many people we have total?
We got about 130 active employees.
And only 105 of them taking health insurance.
That's right.
So we've got a large portion of our population that's uninsured. In my mind, that translates to they're not getting care. Maybe because they don't believe they need it, or maybe because they're just not getting it in general. But the reality is, if people defer health care, over time, their health care costs go up, therefore our health care costs go up. So there are two sides of this. There's the right thing to do just from an employee perspective, and then there's a cost savings perspective. And I get it, in the early years, it would cost more to give everybody better health care, but studies have shown over time if people have better health care insurance, they will get access to health care, and over time that lowers health care costs. They catch things when it's not a melanoma versus waiting until it's stage 4 cancer, and then you have a significant cost. And our stopgap's not enough. We're gonna be, everybody's gonna be on the stop, not everybody, but there's gonna be more people on the stopgap stuff because they're paying more for their health care costs because they did not take care of themselves when it could have been prevented. And I realize we're not talking about just the copay at doctor's offices, but when people go into the doctor and they have a study that's needed, or have a biopsy that's needed, or have something, and they make the decision that they can't afford it, they defer it, our costs go up over time, and their health care goes down over time. And we want to reverse those curves.
Will you hand that out?
Option C doesn't accomplish that.
Okay.
I personally do not like the high deductible plan because I believe that people take that because they think, well, that's more money back in my pocket, but then they defer their health care and they don't get it. I've personally done that when I was younger and didn't have any money. I mean, I had to make decisions. So,
Well, you would have been in good company, because I think we all did that
Right.
when we were young, yeah.
And I don't think we should incentivize people to do that by putting something in front of them that tricks them into doing it.
Right. This that he is handing out is just simply, we put so many acronyms in this presentation, we wanted you to just have sort of a key, so if you were reviewing it later, it would make a little sense. So one of the things we also talked about is we don't want to increase cost. I even Googled Google doesn't understand when you want to spend more money. Even Google has a question mark. But we started looking at what that would look like, how to get that deductible down. And so one of the things that we also talked about is we have two things. One, do you want to lower the premium? And two, do you just want to lower the deductible, or do you want to do both? What are your thoughts? Are you up in the air on that?
I realize that a lot of this is, we're on a short timeline. And I'd ask that we not be next year. We can get ahead of this and start talking about this throughout the year, even if it's conceptually. But just looking at our 3,500 point plan, I would argue that the family costs are probably pretty fair compared to other organizations in the thing. Our employee only is right on key. Our employee and child is right on key. I feel like our employee and spouse plan, which only 9 people are taking it, but that's probably a little, we're probably heavily subsidizing that over the rest of the plan. That's probably a really good value. I mean, I think the deductions that the team members are paying in the $3,500 plan are a fair value to the team members. But I don't think we should be having them hitting them with a $3,500 deductible. I would be willing to cover some additional percentage costs to have them where they're kept whole but have a lower deductible.
Okay, so if we do that, then our recommendation would be that we increase the HRA to cover more of the deductible and solve that problem without changing the base of the plan. When I worked with underwriting into last night and talked about it, we're going up about $125,000 a year just by lowering the deductible, because they actuarially know that that means more people are going to meet it. So if we take care of the deductible on the back end, as opposed to changing the plan's contract overall, we can maybe get to the same place. And we've done a great job educating the employees. We know this because we receive so many health reimbursement account requests for this year. So there is a way to accomplish that without actually changing the model of what you're doing. So what are your thoughts on, instead of a $3,500 deductible and half being paid, what are your thoughts on $2,000 of that being paid, so that turns into a $1,000 deductible? Or do you want to alter the $1,500 that turns into a $750 and the $35 that turns into $15?
I just feel like people don't understand.
Or $1,750?
You know, I feel like people, when they're faced with the decision, if you got to pay this, but you might get reimbursed, I don't know that they.
We've had about a third of the people actually
Yes.
take advantage of the reimbursement.
Yes,
A third of the people who in the plan, or a third of the people who are eligible.
the whole,
In the plan,
yeah.
total. That's a third of the people overall, whether they spend any money towards their deductible or not. So it's probably closer to well over half that actually were eligible for it and actually spent the money, took advantage of it.
I'd like to take a moment to kind of flip side to an employee perspective here. If you're an employee here and you're facing some elective surgery, and you have the $3,500 plan, you know that once you meet the deductible, which is very likely going in for surgery, that then it's going to be reimbursed at 100%. So you're not going to have those additional costs when you're finished with your surgery. However, if you're in the $1,500 one, you're going to meet your deductible, but then you're also going to be obligated to pay 20% of the cost.
There are some co-pays on the $3,500. There's some inpatient and
Right.
outpatient. Yes, sir.
Yeah, so I mean, the employees deserve to have a choice. I mean, there's no one forcing them to take $3,500 or $1,500. It would depend on their individual situation, members of their family, and there's a lot of factors that go into that. And I don't think that we should say, okay, let's just, this isn't like turning a tanker around. It takes time to kind of think about what we want to do. I don't think that we should drive it to the point where we're forcing employees to change what they may want at this point. And so I think we need to be cautious about this, fiscally conservative, and look at it from a larger picture. And I understand that maybe people may defer health costs, but also remember something. I don't know how the exact number is, how long our average employee works here, but it's less than 7 years?
About 7 years, yes.
About 7 years. All right, so I mean, if you come in and you're 22 and you work here 7 years, maybe you'd never even use the health insurance. Who knows? I mean, we don't know that. When I was that age, I probably rarely ever used my health insurance. Flu shot was out, nothing, and so, I think we need to look at a little bit broader perspective, and I appreciate the fact that, preventive care is very useful, and I certainly would encourage people to do that. And most of the preventive care that you could do doesn't cost the employee anything. Screenings and things like that are not, you don't have to pay for those, and they encourage you to do those. So I think we need to just be really cautious about, let's not throw everything out here, and let's just kind of move along with what we're going, because I think everything's working well. And I know it was a well thought out plan. We spent a lot of time when we first did it. we're saving an enormous amount of money, and I think I think the employees are satisfied with what we've given them for health insurance here. I think that a lot of them are very happy. They were very cautious and at first, I remember, when you had the employee meetings, they were like, oh, now what are you doing?
Yeah.
You know, and I think it was well received and continues to be well received. And I think it's a wonderful plan. So I want to just be cautious about it before we move forward with it.
Well, let's,
Go ahead, Bob.
Sorry. A question, I realize we haven't had time to poll all the participants, but do you have any kind of read or any kind of feedback yet? You know, based on these ideas being tossed around, any kind of opinions has been shared about what a
People I
preference?
talk to, and it's not just healthcare, it's with everything, people vote their paycheck. And they'd rather pay less for insurance and keep the higher deductibles because they don't think they're gonna hit the deductible anyway, because they don't go to the doctor that much, and they'd rather just have $20 or less a week coming out of their paycheck. But to Commissioner Stevens' point, we're always gonna vote our paychecks.
And you know, if you ask them, hey, if joint water sewer give you an extra $1 an hour to buy trucks without airbags, they might say, yeah, man, we don't need airbags. Well, we don't, you need it.
What do you think is $1,000 deductible? Where do you want to land on the deductible? Give me a number.
Well, I'm gonna
If it
give
was
you,
me-
go ahead.
If it was me, the way I would do this is, you know, I know we're on drop deadline.
That's okay, we can make it happen.
To get this done. If it was me, I think what we should do is decide what we're willing to pay for healthcare as an organization. And then let's sit down in the workshop with you and the plan, and let's work the numbers in real time so that we can understand how we can get a low deductible for our team members, keep the costs down, keep them from going up, and figure out how we can back into a number that we're acceptable with. If we decide that we're paying 1.8 now and we're willing to pay $2 million, then let's figure out how we can design a plan around $2 million. We're willing to pay 2.5, whatever. I hear you that, you know, that we got a great plan. I don't know that I agree with that, but I do say that our employees are our most valuable asset. We need to take care of them. We need to make sure they're healthy. We need to take care of them. We need to make sure they have access to get what they need. And you know, I've seen it. I've seen it with friends. I've seen it through work where people defer things because they don't want to take care of it, and then they defer it. I had a friend of mine in my hometown who had something on his neck, and he deferred it, and a couple of years later it was unstoppable cancer death.
Okay, let's,
That happens when people cannot afford health care and they make a decision that they're gonna go with an HSA plan, and but they don't put any money aside for it. They're just taking the high premium and they're not actually investing in that account. Or they're taking this high deductible plan, and then when somebody says, well, hey, for $2,500 we can do this, I don't have $2,500, so I'm not gonna do it. I don't like the high deductible plan.
Understood.
okay,
So-
let's do this. Andrew, would you give us a summary of what you're recommending to us so we can get a motion on the floor? So then we can talk about what we might want to change, because we're talking about deductibles, but also we're talking about the stop loss number. So, I mean, there's other issues here too.
Right.
So can you just summarize what you're going to recommend to us?
My recommendation, based off, I understand Commissioner Stevens' point. I think the HRA has been very successful in reimbursing people's deductible and giving us a lower option for the HRA. If we want to pass on some of the savings we're getting on the claims to the employees, then do it by increasing the HRA reimbursement so that the deductibles effectively become, if we do 75%, if you'll go, if we do 75%, then effectively their deductibles are $375 and $875. Because, and once you spend above that, you're getting it back. And so we can do that, and then that's $40,000 or $50,000 of that savings we're providing back to the employees if they use the health care. We're not paying for health care that's not being used. I do recommend we take the $75,000 stop loss. Looking at the numbers, the likelihood of that coming into play based off of the claims we're seeing is very slim. And if somebody is going to hit 60, in all likelihood they're going to hit 75 anyway, so you're going to, I mean, it's not going to be that big of a difference at the end of the day. My recommendation, leave the plans the way they are, increase the HRA to 75%, and go to the $75,000 stop loss.
Yep. Mr. Chairman, I'd like to make a motion following Andrew's recommendations. I move the Brunswick-Glynn Joint Water and Sewer Commission renew the employee insurance coverages as presented, and we take the $75,000 stop loss coverage for us, and we increase the HRA reimbursement up to 75%.
Do you have a
I'll second the
second?
motion.
Motion and second. Any questions?
So you're saying keep the $3,500 plan exactly where the costs are?
Where the
all
costs
that.
are. All the deductions would be the same to the employees, but if they actually hit the deductible by taking that higher deductible plan and getting the lower deductions, they'll get 75% of that back, and you'll have an $875 deductible for that amount instead of a $3,500 deductible.
So that-
What is the cost impact of getting rid of the $3,500 plan, putting people, and basically doing the same thing, but putting making basically the $3,500 plan go away, but keeping the $3,500 rate at $1,500?
Was 160,000?
160,000 minimum.
Minimum?
Minimum, because that $140,000 to $50,000 in claims that she was talking about earlier would be minimum increase in claims.
Right.
And that also, yeah, so you're talking about $150,000 to $160,000 minimum.
That was on
increase.
deductible, but on the higher end, another 100,000 on the bottom line of minimal claims, so about 240,000.
But they have the option to choose the plan, and with the $3,500 deductible, then it covers 100% of cost.
Once you go above the deductible, other than your co-pays.
Minus, and
and-
some of those co-pays are significant.
But on the,
Yes.
but on the
$400
$1,500,
Yes.
$1,500 deductible, then they're responsible for 20% of the cost up to a $4,500
Out of
cap.
pocket, that's correct.
So I think they were to have the option.
I will say, when we did this has been a couple of years, when we presented these new plans with the 80% and the 100%, they had examples of, say, you needed to have, knee replacement surgery. The cost at the end of the day, out of pocket, is pretty close because of that 20% that's included in there when you take the savings on the deductions. And so I think, honestly, those examples are why the vast majority of our staff took the $3,500 plan.
And I will say, just in my 25 years of experience, this will be the lowest deductible of any plan that I know of in Glynn County. Below Glynn County, below the city, below any other organization. So this would be a significant.
Lowest deductible of
significant-
anybody that has a
Because
deductible.
the $3,500 deductible is really $875.
Right,
And we're still giving each employee an option
giving them options.
as to how much
They
they
still have
want out
all
of
three
their
options, can
paycheck.
still got the HSA if they want.
Right.
Can I ask one more question? Of the 20 or so employees that don't carry insurance through JWSC, do we know how many of those are on another plan through their spouse?
At least
Or-
half of them, we've got a handful of members that are on full Medicare, so they don't take our insurance. We're thankful, we've got 3 or 4 retired military personnel, and they've got TRICARE, and they're gonna take TRICARE over what they have to pay for. And then we have a few people that say spouses work for the school system or the health system, and they take those plans. So it's probably about half, and then you probably got 10 employees that are, 20-year-old young men that they ain't going to the doctor unless something gets chopped off. So, I mean, they're just not gonna take the
We got
insurance.
24 people who are taking dental and not health insurance. That's telling you me. I mean, according to these numbers, there's 24 people that are taking our dental plan.
Right, and so like the people on TRICARE take the dental because
That's correct.
They'd
TRICARE doesn't cover
they'd
dental.
rather look nice than be well.
people on Medicare take the dental because
Right,
Medicare doesn't cover dental.
dental.
In a nutshell, I mean, I'm just to say how I feel about it. Conceptually, I don't, disagree with the change you just made. I think this is a hugely important thing for us to make a decision on after 40 minutes and not really understanding the math. I think we need to, pause, get into the numbers, understand them, and not just make a willy-nilly decision, and make sure that we're taking care of our team members. And I think this is the most important thing we got on the agenda all year long.
I think that this is not willy-nilly at all. I think this is well thought out. We've been doing it for a few years. It's been tweaked. And, the process that was initially went through this was extensive. And, I have said, I'm very impressed. So I think that we are fine. I don't think we
I'm
need
not
to.
saying it's poorly done. That's not at all what I'm saying. I'm saying our decision process and our discussion is,
We've had Ms. Tyndall coming in every 3 months to give an update on how things are going. We can start making that a discussion item at the finance or HR committees, when she comes in, and we can talk about every 3 months what changes you want to look at before we get to next year.
I
think that's a
the plan is poorly
good
done. That's
idea.
not what I'm saying at all. I'm saying the decision about whether we, what we invest in our team members is a very rapid decision for you.
And Tripp, you're in the healthcare system, and you have a more intimate knowledge than most of the rest of us, and I get that. But if we were to talk about it for another 2 weeks, people that aren't in the system, that don't understand the system, not going to understand a great deal more about the system. than what we've got now. I trust what has been brought to us and the people that brought it, so. I'm not opposed to having quarterly updates and milestones for the next year. I think that's an excellent idea.
Yeah, I'm all for
And
that.
that comes out of what you're saying, so.
But what we're never gonna know is how many people are not getting what they need based off the decision that we're making forward. And that's why I would say, you know, what are we willing to invest, and how can we make that investment the best way for most people? And I don't know that we've done that exercise.
Well, going forward this next year, I think a Human Resources Committee and like we mentioned, the Finance Committee needs to get involved in this at an earlier stage, but right now, we need to go ahead and do something now. We've got a motion and a second.
Well, we don't have to do something today, but we would have to have a special call meeting again before the end of the month.
In my opinion, it's important enough to do that. But
We would want to do that next week.
Yeah, next week we'd have to
We
do
would
that.
cancel all the employee
Yeah.
meetings and just reschedule those and have a
So,
meeting next week.
If you want to defer that decision to next week, we do another special called meeting, that's up to y'all.
the only
We
way
we have a motion and a second on the floor.
That's correct.
If somebody wants to amend the motion, they can, welcome to do that. Otherwise, we'll act on the motion and second that's on the floor. Hearing none, all in favor of the motion? Motion carries 6-4, one abstaining.
I'm not abstaining, I'm voting yes.
Okay, okay.
No, you didn't raise your hand.
Well, we didn't call against, but if we do, then we'll vote.
I apologize.
Okay. Thank you, Ms. Tindall.
Thank you very much. And we are happy to have those meetings whenever you're ready. I know the intention is just to do what's best for the employees, and that's great.
Well, I want to
We're
lower
glad to do it.
I just think they're too high to, you know, in some categories to give people access. Anyhow, we voted.
Understood. Thank you very much.
And we've done a
Thank
good
you for the
job.
acronyms, too.
Take them home, it'll help you rest.
Okay. I was thinking you might have worked for NASA at one point.
The next item is the approved minutes from the May 19th, 2022 regular meeting. Can I have a motion to accept those minutes?
So moved.
The second?
Motion.
Motion second. All in favor? Motion carries 7-0. Next item is fiscal year 2023 rate resolution. Ms. Roberts.
Thank you, Mr. Chairman. You did receive a redlined version of the proposed FY 2023 rate resolution. Just as a little history, you may recall that each June we revisit the rate resolution just to see if there are any changes that we need to make, whether those are housekeeping or those proposed operational changes that need to be done. In this particular case, there are actually 4 sets of red lines to which I'll draw your attention. The first being basically just housekeeping, as I would call them. On page 1 of 7, you'll notice that the dates of effectiveness for this particular version of the rate resolution have been changed to reflect this next fiscal year. And the date of adoption there in the bottom left corner has been changed in anticipation of adoption occurring today. Turning to page 2 of 7, you'll see that the volume charges have been updated to include the information that you passed at our last board meeting to amend the rates for usage over 6,000 gallons and over 20,000 gallons. We did keep those tiers, but change the rates appropriately with those. Next change that you'll see is on page 6 of 7. This has to do with our hydrant meter rentals. We previously had that value at $2,000 for a deposit on a hydrant meter. Unfortunately, we have learned that we can no longer purchase a hydrant meter if one needs to be replaced in the case of damage or loss for that particular amount, so we have requested an increase to $2,200. And then the final set that you will see, yes ma'am, I'm trying to get through it, Ms. Janice, Section 12, deposits. At last month's meeting, we had discussed amending the customer deposit policy. And the changes that we proposed would be to the ordinances primarily for the city and the county, but then they would refer back to this rate resolution. So the language that we've proposed in this rate resolution allows us the flexibility to determine when to require a deposit, when to increase a deposit, when to waive a deposit, and also how to credit or refund that deposit back to the customer once certain criteria are met. So those are the four proposed changes. Referring still to the deposit policy, the question had been raised at last month's meeting how we would define the phrase "in good standing" when we're talking about a customer in good standing. That's a policy decision, that's an internal policy, but just for the record, that definition will be a customer who has no cutoff fees assessed or account disconnections for a delinquent payment. So I hope that satisfies the concern that was raised at last month's meetings.
Mr. Chairman, I'd like to offer a motion.
Okay,
I move Brunswick-Glynn Joint Water and Sewer Commission approve the attached rate resolution for the fiscal year ending June 30, 2023.
I'll second the motion.
Comments, please?
go ahead.
Approving this, should the commission approve it, this will be the first rate increase we've had in 4 years. So the last three, we had a goose egg basically for each year, 0 increase for all customers. On this particular increase, as I understand it, it only affects the high consumers for water only and not for the sewer portion of the service.
Yes.
So just one example you might want to offer, Ms. Roberts, either you or Mr. Burrows, is what does this translate to for a high user on a monthly basis? Just give me an example, whether it's 6,000 or 10,000.
If you use 10,000 gallons of water, and sewer combined, your total bill will increase $2.24.
Get that, Gordon, $2.24 increase on the highest user.
And then I'll also point out, based off of historical billing data, this will not cause an increase for 70% of our residential customers. 70% of our residential bills are below 6,000 gallons a month.
So the $2.20 and change is well below the CPI for the current year and well below the CPI for the last 3 years. Okay.
And those numbers are not per RU, they're fixed.
That's fixed. That's based off of gallons of usage.
Usage, consumption only, yes, sir.
Yes. The RU charge is not changing.
No, I know that, but I'm saying it's not per RU.
That's correct. That is correct.
And for those who missed the in-person town halls, that's where Mr. Jackson received his information. We actually had some lovely charts that showed if your usage increased to these levels, what your water bill would be based on that usage.
And he heard it several times.
That's right, that's right.
I only did it 6 times this year. Last year I did it 8 times, so,
Okay.
we cut it down to.
If there are no more questions, all in favor? Motion carries 7-0. Thank you. Next item is the deposit refund policy. Ms. Roberts?
Thank you again, Mr. Chairman. Continuing the conversation from the rate resolution to the ordinance now, we will need to request the recommendation of the City of Brunswick and Glynn County to change the ordinance sections that are applicable to the deposit policy changes that we would like to make. Once again, just to remind you why we are requesting those, one of the items in Mr. Burrows' proposed annual budget presentation to the commission was that there were certain policies within our organization that we would take the opportunity to review to make sure that we're similarly situated to other organizations, other utilities, neighboring communities. In doing so, we did identify some sections of our ordinance that would need to be modified in order to bring about those changes. We presented those red lines to you at last month's meeting, and again, the question that arose about the phrase "in good standing," we believe we've resolved that concern, so now we are bringing those to you for your recommendation to those other boards for their passage of the ordinance red lines.
Essentially, the ordinance revision would just refer to the deposit policy is held in the rate resolution, which is discussed every year at public meetings.
Right. Can I have a motion?
I'll move that the Brunswick-Glynn Joint Water and Sewer Commission recommend to the City of Brunswick Commission and Glynn County Commission that the ordinance sections related to customer deposits be amended as shown in the attached document.
Second.
Motion is second. All in favor? Motion carries 7-0.
Thank you, Mr. Chairman.
Next item on the agenda is Connection Assistance Program. Mr. Burrs?
Yes, sir. We have discussed this at a couple of meetings in the past, and based off your feedback, we are prepared to move forward with offering connection assistance financing for new connections to our system that are existing structures that are on well and septic tanks. So essentially, for those customers, if there's new lines available or current lines available and they have well and septic tank, we're trying to make it more cost effective for those individuals to get on our system rather than having to pay all that value up front. They can still pay it up front if they want to, but we're proposing to allow that to be financed through us. So existing structures, so not vacant lots, but existing structures that are not connected to our public water and sewer systems, JWC-owned water and sewer systems, will be allowed to finance the cost of the capital improvement fees and the operational charges associated with that. Now, and when you pay a capital improvement fee, the total capital improvement fee has three sections. It has the capital fee section, it has the operational charge section. The operational charge is the cost of the meter, connection, and the inspections associated therewith. And then there's an administrative fee, which is your account deposit and the account startup fee. So they would still be required to pay the account charges to start the account up front, which is a $155. $100 deposit, $55 application fee. So the rest of that, above that $155, will be allowed to be financed, and financing is again only available to existing structures. New construction projects will be required to pay up front, full amount, and financing is only available to the water and sewer account holder. So to avoid a situation where we have a property owner that is not the account holder and we have a tenant in that account, where the tenant is not the one responsible for paying the monthly charge to connect to the water and sewer system when the property owner is the one that's actually getting it connected. It's only, the financing is only allowed for those that are the account holder. So if a property owner that is renting it out wants to finance that tap, they'll have to put the water account in their name, and their tenant would have to pay that to them through their rental agreement and not straight to the Joint Water and Sewer Commission. So the financed amount will be shown as a line item on your monthly water and sewer bill. When you get your water and sewer bill, there's already 5 or 6 line items, so there'll be a new line item that says capital fee financing amount and whatever that amount is for your particular situation. Failure to pay the full amount on the water and sewer bill plus the financing charge may result in disconnection with our other policies. If you don't pay your bill and you get that balance where you get disconnected, if that balance is simply the financing charge, you will still be disconnected for getting that far behind on your payments. So we offer options of, you can finance between 3 and 10 years, and the interest rate, that's an annual interest rate, increases the longer you finance it. And here's what the payments are, and I just realized I forgot to do something Commissioner Stevens asked me at yesterday's meeting, and I apologize. But a 5/8 inch combined water and sewer meter, that the capital fee associated with that is much lower than a 1-inch meter, and the 5/8 inch meter will do the vast majority of all residential customers, unless you have a multi-story house or have a considerable water usage. A 5/8 by 3/4 meter is typically more than sufficient. So if you're a combined water and sewer new customer, you've got a private well and a septic tank, and you want to get on a 5/8 inch meter, you can finance up to 10 years for that, and to be $34.71 per month added to your monthly bill. What is more likely to happen is a lot of the situations, say the project we're currently undertaking at ARCO, the vast majority of those customers have public water already. They do not have sewer, they have septic tanks, and so they would not be financing the water connection charge, they would just be financing the sewer only charge. And in that situation, if you did it for 10 years, the sewer only charge is $19 a month, $19.43. You see the rates there if you go for the 1-inch. We did the math yesterday on one of these. Over a 10-year loan, you're averaging about $60 or $65 a year in interest on the payments associated with this. We had some questions yesterday about, could people pay off early? You could pay the full amount off early, but you can't pay extra. You can't say round it up from $34.71 to $40, because the administrative task of having to recalculate what's remaining every single month to put that on your bill would be quite a burden on our billing staff. But if you want to come in and say, what's left on my balance? Now, I got my tax refund this year, I'm going to pay that off. We can tell you what's left, and you can pay it off at one fell swoop at that point. If you pay extra, it will just show up as a credit on your next bill and will be used towards next month's bill. So if you round up that $5, you're just going to see a $5 credit on your next month's bill.
Can I have a motion?
Sure. I move that the Brunswick-Glynn County, the Brunswick-Glynn Joint Water and Sewer Commission approve the creation of connection assistance policy effective July 1st, 2022.
Second.
There's a few questions.
Yeah, one thing
Motion
real quick, I was
second.
gonna say, if this is approved today and it goes into effect, this will become something that is reviewed with the annual rate resolution. Should we need to adjust those interest rates because the cost to service the program has went up and we need to increase those interest rates to cover our cost. But that will be reviewed every year.
That's a question.
Yes.
So the goal of this is to get people on the
Yes.
system, obviously.
That's correct.
And we have the ability to put a lien on the property.
Yes, that,
So to that end, do we really need to collect a deposit on it? I mean, is that not a boundary to getting people on it? And it's not really like it's going to us, it's just money sitting. I can just picture that being a way of them getting on it, having this money sitting out there as a deposit. And we have the ability to put a lien on the property. I don't really see what the deposit.
well, I will say, part of the deposit policy improvements we just approved, there are ways the deposit can be waived.
Well, that's what I'm wondering, if we should just waive the deposit for people who are translating to the program and financing it with us. Or if they're not financing, it, they're paying cash up front, that's even better. You know, if you're not an existing customer, but you're an existing structure, that's not an existing customer, we'll waive the deposit, because, you know, frankly, we're putting a lien on your property, you won't pay it anyhow. And then you don't have this $250 barrier of people getting on our program.
The
At
deposit?
the same end, would you not, you know, finance the administrative charge up front? Just tack that onto the thing?
The $55.
How much?
The $55
I
and then,
thought $155.
it's $55 administrative and a $100 deposit. So the total is $155.
Oh, it's $100 deposit?
$100 deposit. Unless you have past bad account histories with us, and then it can be $250.
I was thinking it was $250.
Now, $100 deposit, $55 account startup charge.
So
I'll be in favor of waiving the deposit personally.
in ARCO, those are water users already.
Now, they've already got
Have-
deposits.
Already have accounts, so they either have a deposit or it's already been returned, depending on their credit worthiness.
That's correct.
Okay, so it would be circumstances where a customer has no public service at all that we would evaluate through our policies whether we charge a deposit, and our deposit policy as approved now would be depending on their credit worthiness.
That's correct.
Basically, okay.
That's correct.
Just random, in that area, the ARCO area with the homes, when he mentions liens, how many of those properties are even owned by the people that live in the homes?
Well,
'Cause
that's
that-
the question. For this program, the property owner would be the one that have to finance this. Because obviously, we don't want the tenant, unless they work something out with the property owner, can't just get
Right.
make the property owner connect to the system. So they would have to change it into their account name. Yeah, a lot of those are rental properties.
In that particular area, I remember when we had the meeting, is it most of those in the county or city?
Most of that's the county. Almost all of that's the county.
That's when we were talking.
And then, for example, on that project, there's about 400 properties, probably say 350 structures there, maybe 50 vacant lots out there, somewhere in that ballpark. Of those 350, you've got about 40 that don't have water. The other 300 to 315 of them already are on the water system. So that would be sewer-only connections for that project. But I do want to point out, this doesn't just impact ARCO. We've got people all throughout Glynn County that have a sewer and water line literally at their front door, right by the right-of-way there, and they own septic tank. And may have failing tanks, and they've been getting quotes for $25,000 to replace a septic tank right now. And they can get this and start financing this for $30 a month, which is great for.
Yeah.
I mean, it's great for them. I just think it's clear to the
No, I
public.
understand, it's the commission's discretion. If you want us to finance the deposit too, that's easy enough to make that adjustment.
I just waive the deposit,
Just, okay,
because you put the lien on the property.
right, okay.
But just a nuance, I mean, again, I'm all for it, but the nuance is, someone needs to define what we're calling existing structure versus, and what I mean by that is somebody's gonna come in with a piece of, something that's existing structure that is just in horrible shape, and they're getting a permit to completely replace the whole thing. Are you gonna count that as an existing structure, or are you gonna require them to upfront pay the capital tax fee? Don't care either way, just something to put.
Something to think about, sure.
Y'all figure it out.
Well, the deposit, though, goes toward the actual total cost, so it's actually lowering their monthly bill.
Yeah, a little bit, yes, sir.
Yeah, so, we have a motion on the floor.
And it's like,
A second. Anybody got any other questions? Hearing none, all in favor? Motion carries 7-0. Thank you, Andrew. The next 8 items on the agenda are equipment items at the different treatment plants, and also some pump stations and things like that. All 8 of them have been approved by both the Facilities Committee and the Finance Committee for presentation to you. The first one is Academy Creek Water Pollution Control UV equipment purchase. This is being presented because the permit at Academy Creek is changed, and that's requiring the UV ultraviolet disinfection instead of chlorine disinfection followed by hydrogen sulfide for dechlorination. And also it's going to be safer for the operators out there and for the neighborhood community. So Andrew, I'd like for you to just present that briefly to
Yes,
us
sir.
so we can.
Okay, so we had 2 proposals come in for this. We had a 3-member team score these proposals. A member of senior leadership and 2 operation staff members reviewed these proposals. The highest scoring proposal was submitted by Trojan Technologies. The other proposal was submitted by Wedico. I will point out this is being funded by a grant secured through the Governor's Office of Planning and Budget, or a $1.9 million total grant for the installation and purchase and installation of the equipment. So this funding is not coming out of our reserves at all. So the highest scoring proposal was from Trojan Technologies. There's still some discussion whether the funding requires Buy American preferences, but on the safe side, we're going to make sure we meet Buy American preferences, so they'll refund us our $1.1 million instead of deciding we didn't meet the qualifications. So we are recommending moving forward with Trojan Technologies for the purchase of the UV equipment at $1,125,000. This will, delivery is about 38 weeks out, so we will be putting out a bid proposal for a contractor to install the equipment at a later date once we have a more firm ship date.
What would that go bid?
780,000, but it will not meet by American standards.
There's other issues too.
There's other issues as well. It's got twice the number of bulbs, so you've got a lot more parks that have to be maintained. So think of it, these are not the right numbers, but think of it as a 40-watt bulb versus a 60-watt bulb. There's a lot of differences in the system. The Trojan unit, these are the 2 main manufacturers of UV systems. We've talked to people, and the feeling we get is the Trojan is the better fit for us.
And if we find we don't need to buy America, it's
Then we can-
$200,000 deduct.
We can
from this
save that
price.
$200,000 deduct if we don't have to have Buy American. As we know, with a lot of these federal funds that have been put out, the standards are still being developed as we're moving forward.
These behind existing meters?
These would be on the chlorine contact chamber at the wastewater plant.
So we're not adding Georgia Power infrastructure behind the meter?
Behind the meter, we'll have to increase feeders to the structure, obviously, to get all the power there and increase the panel, but yeah,
So it's all behind the meter?
all behind the meter.
So when we're doing projects like this, or really all the projects, are we working with them on looking
Yes.
at are we on R2P at these plants?
Yep,
Everything's just CBL or
Yes.
just power and light?
power and light. Right now, the power bill at Academy Creek really isn't as high as you'd expect because we use liquid oxygen. So we don't have the big blowers that are turning that huge power bill. Our power bill at Academy Creek is only like $25,000 a month. So there's really not a huge savings there that's available for us.
And we're purchasing this piece of equipment ourselves.
Purchasing outright, and then
Avoid, we don't have to pay the taxes.
we don't have to pay the 6% sales tax or any markup for
from
carrying that material.
Right, okay,
And we have more schedule control because we'll know when it's coming, and then the contractor
right. You could
will know
schedule
when it's getting here as
everything,
well, which also should reduce the contracted installation charges because they don't have to carry that float.
right. I think one other thing is that this translates into something very positive from an environmental standpoint. Because right now we're adding chemicals to kill bacteria, and this system, instead of adding any chemicals, just simply sterilizes the bacteria.
correct.
So they can't reproduce. I don't know what the lifespan of a bacteria is. I would assume it's quite short.
Very small.
Very small. So I mean, it reduces the threat to any staff, because chlorine is obviously a dangerous thing to have around. It requires very careful handling and training. So this is a win-win all the way, I think.
I lost place. Have you had a motion yet?
No.
I'll move that the Brunswick, the BDJWSC purchase UV disinfection equipment from Trojan Technologies in the amount of $1.125 million for installation at the Academy Creek Water Pollution Control Facility.
I'll second the motion.
Motion second. Any other questions? Hearing none, all in favor? Motion carries 7-0. Next item is the Dunbar Creek Water Pollution Control Rehab Phase 2 Services Contract Award. Mr. Burrs?
Yes, sir. Dunbar Creek is a wastewater plant on the island. We've been under Phase 1 services for a progressive design build contract to rehab that wastewater facility. There are 10 items listed there in your memo that were included in the scope of work associated with this project. At the last month's meeting, we did an early work authorization for item 10 to get that aeration basin back in service before storm season got upon us. So we're looking at the first 9 numbers here. The first 7 are included in the base scope of work. Number 8 would be to add a third clarifier to increase the treatment capacity. And number 9 would be to change the main entrance to the facility, instead of coming through the Glen Haven neighborhood, to come off of Sea Island Road. So we went back and got to Phase 2. At Phase 1, they get through 30% design. They get a conceptual design. They've done some research. They've got pricing. And now we're at the point where they have provided us what's known as a guaranteed maximum price. This does not mean we're going to spend this amount of money. It means they cannot go above this amount of money unless the scope changes. So the guaranteed maximum price for the base work, which includes the first 7 items, and also that includes the design from 30 to 100%, so this includes engineering, is $3,660,309.84. To add the third clarifier would be an additional $3,384,286.18, and the roadway would be $497,442.16. Given that the third clarifier would be almost as much as the rest of the project, we are recommending avoiding that third clarifier at this time. We do not need to expand the capacity at that treatment plant at this time, and it can always be added later if we ever do need to expand that capacity. But we do recommend moving forward with the entrance road to get our equipment and vehicles off of that neighborhood street in Glen Haven and coming off of Sea Island Road. That reduces our liability and provides a betterment for that community. 2 things to point out. The next 2 items on your agenda would be to purchase UV and filtration equipment for this project. As Commissioner Cook pointed out on the last item, purchasing these large equipment items up front reduces the markups we pay, and we also don't pay sales tax. On this item, the Phase 1 services, one of the agreements we have is what their markups will be. There is a 10% overhead charge and a 5% profit or design builder's fee charge associated with any item, so we'd be saving 15% by buying these separately. However, for your information, the UV equipment is $351,165, and the filtration equipment is $671,005. So in summary, we paid $53,500 for Phase 1, which is complete. This bottom item, aeration basin 2, which is previously awarded, is $3,055,480, and then the items from base scope of work to the filtration equipment would be what we're considering with the next 3 items. This item would be the base scope and alternate 2, so the total requested award for Phase 2 services is for a guaranteed maximum price of $4,157,751.30.
Have a motion?
I'd like to make an amended motion to what's on here for me. Yeah, I move that the Brunswick-Glynn Joint Water Sewer Commission authorize the executive director to award a contract to BRWR Construction in the amount of $4,157,751.30 or less for Phase 2 services at Dunbar Creek Water Pollution Control Facility for completion of the base scope of work and alternate 2. And the reason for the amended motion, I see a few things in here that I think if you looked at,
Right.
There's probably some stuff in here, like we're paying them to pay for the electricity. We can just hook it up behind our meter and not have that in there, and therefore not have the profit margin they've got, and that type of stuff. So there's several things here I just noted quickly.
Well, with that being said, again, this is at 30%. As we get into construction, we may find savings as well as we start digging. So again, having that or less in there is certainly beneficial.
Authorize you to make the award, but let's not award it today. Let's authorize you to make it.
Second.
Motion second. Any questions?
Yes, on the road portion of this, I have mentioned the possibility of Glenn County having some benefit out of that road. Have you had any discussions with Glenn County yet of possible mutual benefit that could possibly result in some cost sharing?
What we have struggled to determine is how we would allow traffic to pass through there and maintain security for the wastewater facility. It's very tight in there, and that is at best a one-lane road. It's definitely not a two-lane road coming in and out of there, so
Doesn't look feasible.
it doesn't look feasible at this time.
But this will eliminate traffic from the plant.
We'll
going
eliminate
the
through
neighborhood.
Glen Haven, which will certainly help traffic on that roadway. We have equipment coming in and out of there. That's a narrow street. People park on the side of the street, and so coming in off of Sea Island, we do agree with, we talked to Glenn County, we will not be bringing equipment in and out at rush hour in the morning or the evening right there on Sea Island Road trying to turn into the wastewater facility. We don't want to back up traffic right there. So that's just scheduling on our part.
Any other questions? Hearing none, all in favor? Motion carries 7-0. Next item is the Dunbar Creek Water Pollution Control UV equipment purchase.
Yes, sir.
Mr.
This
Burr.
is the UV equipment that we just talked about installing at Dunbar Creek. So this is to recommend purchasing Trojan Technologies UV equipment at Dunbar Creek. Remember that Dunbar Creek has a capacity of 4 versus Academy at 13.5. So the equipment is considerably smaller. Therefore, the cost for the equipment at Dunbar Creek is $351,165.
This is a replacement unit, is that correct?
Just a brand new unit to replace what's already there.
What's there,
Exactly.
which is the end of life?
End of life, we're at the point where we're fixing to have spent a significant amount of money replacing parts on that equipment.
How soon can we get that?
We're looking at probably February before this is gonna show up.
I'll make the motion.
That's assuming it hits the schedule they told us.
I'll move the Brunswick-Glynn Joint Water and Sewer Commission purchase UV disinfection equipment from Trojan Technologies in the amount of $351,165 for installation at Dunbar Creek Water Pollution Control Facility.
Second.
Motion second, any questions?
Just one, Mr. Chairman. What we have in there now, is it gonna last until we get this?
Yes. Well, we know, based off of hours use on the equipment, we're getting near the end of the useful life, but it is functional currently and it is meeting permit. We just know that within the next year or so, we're gonna reach the end of the useful life of that equipment.
Okay, thank you.
Hearing no further questions, all in favor? Motion carries 7-0. Next item is Dunbar Creek Water Pollution Control filtration equipment purchase. Mr.
Sir,
Burr.
this is the filters to install at Dunbar Creek as part of that design build project. Aqua Aerobic Systems is the current manufacturer of the filters at Dunbar and Academy Creek. If you have been to the facilities committee, you can see the tremendous benefit we get from having filters on both of those facilities. It helps add a tertiary layer of treatment before it goes out. So this would be to buy new filtration equipment. The current filtration equipment we have needs to, is getting near the point where we got to replace all the media in there, and they're also currently in metal tanks and cannot be relocated out of those tanks. So this would be to buy new equipment that can be installed in the concrete structure, which we don't have to maintain the metal anymore, and we also will get new filters out of this. So $671,005. For reference, the equipment at Academy Creek that we installed was over 1.5 million worth of filters. So everything's a little bit more expensive at Academy just because it's twice the
How
size.
old are the filters right now that we're using?
Those were put in 06.
And is the technology significantly different?
No, sir. These are,
It's just,
best way I can explain it is you have a disc that the water flows through, and this disc is covered with cloth media, and the cloth media, if you need to see it, it looks like bright blue 70s shag carpet.
okay.
They found a way to use that stuff that everybody snatched out of their houses.
And this plant is close to the ocean, and obviously we get salt, and we also have and it's in a steel container too,
Right.
which is really rusted.
Right,
So,
I would imagine, yeah.
so it's due this. We needed to do it about 4 years ago.
Yes.
Okay.
Yes.
Mr. Chairman, I move that the Brunswick-Glynn Joint Water and Sewer Commission purchase the cloth media filtration equipment from Aqua Aerobic Systems Inc. in the amount of $671,005 for installation at the Dunbar Creek Water Pollution Control Facility.
Second.
Motion second, all in favor? Motion carries 7-0. Next item is Pump Station 2032 replacement pumps purchase. Mr. Burrows.
Yes, sir. This is, Pump Station 2032 is on Frederica Road, catty-cornered from Benny's Red Barn. You may recall we just did gravity sewer rehab in the basin upstream of that, and part of the reason we were doing that is because we were getting a lot of groundwater and rainwater in there. With that groundwater and rainwater, we get a tremendous amount of grit that gets in there, and the grit has basically dissolved portions of one of the pumps to the point where it is no longer rehabable, and it's also got inside the wet well and caused the bases that the pumps sit on to shift. So we're in need of purchasing new pumps there. That station is currently on bypass right now, so we need to purchase 2 pumps there. We went out to our 3 main pump manufacturers. Right now, in the current supply chain, availability is just as important as cost if it's reasonable, and there are 2 current pumps available that will fit that station. Flight pumps, the 2 of them would be $60,154.30, and Grundfos pumps at $56,155. I will note that the horsepower increase from the Flight to the Grundfos would require us to replace the VFDs on that station because they're only rated for 50 horsepower pumps. So by going with the slightly more expensive Flight pumps, we save a significant cost to replace the VFDs there. So the recommendation is to move forward with the Flight purchase instead of the Grundfos purchase.
What's the age of the VFDs?
The VFDs, when was that station rehabbed? 5 years?
Yes. What's the expected life of them?
We get 10-year warranties on them. So we also save, the VFDs also lower your horsepower requirements to a certain extent, but of course lower horsepower pumps also use less power.
And how long have we been on bypass?
About 2 or 3 weeks. Now, we own the bypass pump. We're not renting that bypass pump. It's functioning just fine right now, but obviously we want the station functioning the way it's intended and not on bypass.
That's a pretty visible station, too.
Very visible station, yes, sir.
I'll move that we approve the purchase of 2 new pumps for Pump Station 2032, Silent Water Solutions, in the amount of $60,154.30.
I'll second the motion.
Motion is second. All in favor?
I did just a quick question. Sorry.
Okay, go ahead.
Thought you might have to discuss. About $4,000 to ship from a line, how big are these pumps?
These are actually coming out of Mississippi, but
Oh, they're just headquartered in a line.
their office that they're selling it out of is in Atlanta, but these are sitting on a shelf in Mississippi.
How big are the pumps?
They're, what would you say a 45 horsepower pump weighed? A couple thousand pounds?
Yeah.
About the size of that podium.
Yeah, they're pretty good size.
Yeah, that's what I'm thinking. That's a lot of money for shipping that far.
You can go get them this weekend if you want.
For 36, not.
Yeah, hey, if you want to pay for diesel to drive to Mississippi right now?
I think he's got a new truck.
Yeah.
I said,
You get 2 pounds on that thing for
put
$36.95.
put it to work. Well, we'll pay you
It's
diesel.
expensive.
Yeah.
All right.
Any other questions? Hearing none, all in favor? Motion carries 7-0. Next item is Academy Creek clarifier gearbox purchase. Mr. Burrows.
Yes, sir. Academy Creek has 6 secondary clarifiers where the solids are separated out by gravity. The solids go in the bottom and they're pushed into a sludge collector and pumped to the either back through the plant or to a digester, and the water goes out the top. All of them have a drive mechanism that rotates an arm. Through there, there's a skimmer arm on top to push any floating solids to a scum trough, and the sludge on the bottom is pushed to that center well by rakes on the bottom. As you know, we have had years of failed bar screens at that facility, and rags have come through, and what happens when those rags come through, they settle out in the clarifiers and they wrap around those rakes on the bottom, and if you rotate and there's rags there that are causing a increase in friction, it increases the torque, and we popped a worm gear on a clarifier. We went back to get replacement worm gear, and we were told it would be $27,000 just to buy the worm gear, and that does not necessarily 100% fix it, because when we start rebuilding gearboxes, who knows what we're getting into. So our request here is just to buy a new gearbox, whole kit and caboodle to install, $47,672. Rather than, what now?
We put it in.
We'll put it in. It's just to get it here. Vivo is the manufacturer. That is, they are the manufacturers of the clarifier mechanisms that we have.
Can I have a motion?
I'll make a motion. I'll move the Brunswick-Glynn Joint Water and Sewer Commission purchase a clarifier gearbox from Vivo USA LLC in the amount of $47,672 for installation at the Academy Creek Water Pollution Control Facility.
Motion is second. Are there any questions? Hearing none, all in favor? Motion carries 7-0. Next item is a standby generator rental agreement. Mr. Burris?
Yes, sir. Every year, we rent 5 standby generators, portable standby generators from Yancey Cat out of Savannah. This has benefits to us. For one, we know we have 5 portable generators on hand, and 2, in the event of a storm, we have them on hand instead of trying to scrounge the week beforehand to try to track down generators when everyone else in the state of Georgia is trying to track down generators. You may recall we have a FEMA grant to purchase new portable generators, and that bid should be out in the very near future, but we have been advised by the sales personnel that if we order them today, a brand new generator would take at least 12 months to get here. So we are recommending moving forward with the rental agreement once again for this next storm season. So this is 5 of them. The prorated amount for them to get here Monday on the 20th would be $119,862.50. This is a budgeted purchase or rental agreement in the systems pumping and maintenance operating budget and in their line item hurricane preparedness. So this is an expected expense for us.
Can I
They're
have a
5
motion?
230 kW generators, so we can put them on smaller ones if we need to.
Can I have a motion?
I'll make the motion. I'll move that the Brunswick-Glynn Joint Water and Sewer Commission enter into a rental agreement with Yancey Power Systems in the amount of $119,862.50 as presented.
Second.
Motion and a second. Any
We bid
questions?
that. I mean, did we?
This is through Sourcewell, so that's been publicly bid, and you can purchase from Sourcewell without actually having to go through a separate bid process. So it has been publicly bid. Any municipality or government agency can purchase from Sourcewell.
And they have other people besides Yancey in there too?
Yancey won the bid for Sourcewell.
Okay. All right, well,
Any other questions? Hearing none, all in favor? Motion carries 7-0. Next item is pump station RTU panel purchases. Mr. Burris?
Yes, sir. You may recall that finished up earlier this year installing 136 SCADA panels. An RTU is a SCADA panel. We have installed 136 of these, and as we move forward with new pump stations being brought online through new development, we want these exact panels to be installed on the new stations as they're coming in. We have been told by the time the people that are installing new pump stations go through all the markups, they're getting quotes for new SCADA panels in the $80,000 to $100,000 range for SCADA panels. We can purchase them directly from the panel shop for $21,000 a piece. So our request here is to add 3 of these to our inventory setup so that when we need to install one on a new pump station, that installer can purchase that directly from us, and we don't have to worry about waiting 16 to 18 weeks on a new panel to show up, and we don't have to quibble over components that may not be cost effective for that person at the time. And also, if we have a handful of pump stations that we have not changed the SCADA panels out on because they have currently planned capital projects. So when those projects go to construction, we can just hand the contractor a panel at that point. So this would to maintain 3 in inventory, and then as we use them, we would replace them and keep that inventory of 3 in the system. That way
Mr.
we don't
Chairman, I
have to worry
move that the Brunswick-Glynn Joint Water and Sewer Commission approve the purchase of 3 new pump stations RTU panels from Electric Machine Control in the amount of $63,932.46.
Second.
There's a motion and a second. One thing that we mentioned at the facilities and the finance meeting yesterday is, in the future, let's just put that in the budget, in your budget. So we'll have that, because this is a good idea to have this.
Yes, sir.
But we have 165 lift stations out there,
Yes, sir.
so we're gonna always have this
Yes.
coming forward. And that way we won't have to present it.
Same thing happens,
Except with the
we're
budget.
talking about our stations. If we have a panel that's going out and we can't pinpoint it, we can just take the wires out, put a new panel, terminate it, and then come back to
Right.
the office and troubleshoot it instead of having to spend all hours out
Right.
there trying to figure out what's going on with 100 different relays.
Do we have any other questions?
A comment or question is, when we provide these to a developer for a project, my recommendation is that you use the replacement cost
Right.
for one of these. So while we'll only pay $22,000 a piece today, 6 months from now, it might be $25,000 to replace it. So I'd offer that to use as your guidance when you're working those things out with a developer on short notice, that we get replacement cost, not
Very
the
good.
actual.
That's a good point.
That's a very good point, yes, sir.
Any other questions or comments? Hearing none, all in favor? Motion carries 7-0. That's all the purchases we're gonna make today. Now, the next item is infrastructure and easement dedication. Mr. Klein?
Any money left? Let's see. Mr. Chairman, Commissioners, good afternoon. This is a fairly routine dedication of infrastructure and one small easement. This is a product of private development improvements. The developers finished a phase of their project. It's a residential development. Now wishes to dedicate the water and sewer infrastructure to the Joint Water and Sewer Commission for ownership and maintenance going forward. A couple items attached for your information are the location map. This is for Grace Crossing Phase 1. Developers doing this development in multiple phases. They've already moved through Phase 2A, and we're working with them on the final plat right now with that one. This is for Phase 1. It's in the region of Herodiggers Boulevard North, very near Carriage Gate subdivision. Also attached are the record drawings for the infrastructure that we're discussing or considering for dedication or acceptance. And then also a plat is attached of the phase that we're discussing, as well as the dedication documents. As part of the dedication documents, the engineer record also provides the engineer's estimate or probable cost. So that's the value that we'll capitalize if the board decides to accept this dedication. I'm happy to answer any other questions.
Just for future, we include the document.
Which ones?
Dedication documents are?
They're kind of halfway in the back.
Oh, they're in the middle of the folder?
They're in the middle of the phone.
Let's see.
Oh, I see it.
There we go.
We've got differing page sizes in here, but it's this one here. It's our standard form. Got it up on the screen now.
And all of this work was done according to our approval, right? We approved the materials and installation and everything.
Correct, Commissioner. To your point, yes. So even private development or any development that happens within Glynn County that has to do with water and sewer is inspected by the Joint Water and Sewer Commission Inspection Division or Inspection Department to ensure it meets the standards. So yes, it's been observed construction standards, tested, and it's ready to go.
Can I have a motion?
That we approve the dedication of infrastructure in one sewer easement for Grace Crossing Phase 1.
Second.
Motion second. Any other questions? Hearing none, all in favor? Motion carries 7-0.
Thank you, Commissioners.
Executive Director's update, Mr. Burris.
I have nothing today. I have talked enough.
Commissioners' discussion. Anybody have anything to say?
Quick question, kind of like what we just did on the SCADA panels. A couple months ago, we talked about doing something similar with, I think we had a big project, and we had like some bypass pumps that they were contracting to provide. We talked about buying those, like an 8-month ROI or something. We ever do anything like that?
We haven't purchased them yet. We are looking on our future projects of whether that would make sense, purchase them at that point. So we're fixing to put out the North Mainland Water Loops project and some SCADA and then some sewer projects coming up. We will be taking that into account at that point. It is something that we are looking at closely.
Any other commissioners have any? For the chairman's update, I just want to thank the staff for getting these projects moving like this. There's a lot of work to do this, and I know we had this. We authorized the purchase of a lot of equipment and also some major construction projects today. And I also want to thank all of the commissioners today. We had a good meeting, and we had input from each one of you commissioners, and each one of you, I respect your input, and I think each one of you had very valid comments and questions. So I appreciate your participation today. I don't have any other thing that I need to bring before you. We don't need to have an executive session. So the meeting's adjourned. Thank you very much.